So good morning, everyone. We're going to go ahead and get started. I know well over 100 people registered for this session, so there will be other people filtering in. But we're going to go ahead and get kicked off. So this is the second day of our virtual Coalition Academy, and thanks everyone for returning for today. Hope you enjoyed the first day. So for this session, it's called Working Together to Save Lives, collaboration between suicide and drug prevention. And as you can see, we have a few people that are on the panel for today. So Michelle Price will be joining us later with the Ohio Suicide Prevention Foundation and helping me with the panel discussion questions later on. So Michelle is responsible for the support and cultivation of suicide prevention coalitions in Ohio, providing one-on-one support, resources, and funding opportunities. She was drawn to suicide prevention through personal experience with depression, anxiety, and suicidal ideation. She began her career as a suicide prevention educator at Helpline of Delaware and Morrow counties, sharing the Signs of Suicide program with middle school and high school students. Later, she became the Suicide Prevention Program Manager, coordinating prevention education in both counties, and serving as Coalition Chair for the Delaware Suicide Prevention Coalition. There, she facilitated a Survivors of Suicide Loss support group, as well as collaborated with community mental health and suicide prevention partners. Michelle is a certified QPR and Working Minds instructor, is trained in applied suicide intervention skills training and mental health first aid, and is an Ohio Certified Prevention Specialist Assistant. She received her bachelor's degree in comparative religion from the Ohio State University. And then we have Tristan Ball. She's an Ohio Suicide Prevention Specialist and a licensed social worker. She serves as a director for the Montgomery County Prevention Coalition. In her role, she facilitates collaborations among community members to develop and implement strategies that will prevent substance use throughout the county. Tristan has worked to develop environmental prevention strategies in various Ohio communities. Tristan has facilitated several trainings throughout the state and around the nation specific to environmental prevention strategies. Tristan received her Master's of Public Administration at Ohio University and holds a Bachelor of Social Work degree from the University of Cincinnati. And we have Camille Crowick here as a coordinator of Champions for a Drug-Free Grant County, located in Williamstown, Kentucky. She has been in this position since 2016, but has worked in the field of substance use prevention since 2008. Prior to accepting the Drug-Free Communities Coordinator position, she worked at the North Key Regional Prevention Center as the Assistant Manager of Prevention. She has been a Certified Prevention Specialist in Kentucky since 2009. She is a certified trainer for the Prevention Ethics course and the Substance Use Prevention Skills Training for the Department of Behavioral Health. And lastly, but not least, we do have Kim Linkle as the director for the Coalition for Drug-Free Batesville in Batesville, Indiana, and is part of the CADCAD Coalition Development Team. She has over 20 years of experience in coalition development, specifically focusing on substance abuse prevention. Ms. Linkle holds a master's degree in leadership development from St. Mary of the Woods College. Over the years, Kim has held a variety of positions within several coalitions, both locally, regionally, and statewide. Her experience is concentrated on providing technical assistance to both drug-free community grantees as well as community coalitions. Kim is driven by assisting coalitions in creating community-wide change to improve their community one change at a time. She enjoys seeing people come together to work on improving their community by focusing on a common goal. So thank you all for joining. Once again, I'm very excited for this presentation today. We serve the tri-state area as Prevention First, and I really wanted to get an overview of what all is going on across the tri-state. So we're going to go over a few housekeeping slot information and then get this panel going. So For those that were with us yesterday, I'm sure you've heard this a million times, but continuing education will only be awarded to those that view the live session, and then you must attend the entire training to receive the continuing education hours. So a post-event evaluation survey will be emailed within 24 hours and is required to receive continuing education. For social work and mental health counselor credits, you must provide your license number in the post-event evaluation survey. And then for CHES or certified health education credits, you must provide your CHES ID as well in that post-event survey. And you will receive your certificate for continuing education by email within 30 days of the training. That also includes for prevention specialist credits. You'll receive your individual certificate for that. And we'll also email out the evaluation separately because I know some people yesterday had some issues accessing that. And then I do want to mention that the PowerPoint is under the handout section. So you can download that on your end if you'd like to take notes throughout the presentation or just have for your knowledge after the fact. And that's on the control panel in the handout section. And I'll be moderating the question box throughout, but we will have a panel discussion among all the panels today after they each give an overview of each of their organizations and what they're doing. And we'll also have a question and answer after the panel discussion for everyone that's in attendance today to ask individual questions for the panel. So without further ado, we're going to go ahead and get started. So Camille Kroick, go ahead and take it away and explain what you're doing in Grant County, Kentucky.
Abby, I should have asked this to begin. Are you going to flip slides for me?
Yes, yes. Sorry, just let me know
when you
need me to progress. Yeah.
Sure. So like Abby said, my name is Camille Kroick. I am the coordinator for Champions for Drug-Free Grant County, but only until the end of October. And at that point, I will be transitioning to a new position within the Division of Behavioral Health at the state level in Kentucky as the Marijuana Prevention Enhancement Site Coordinator. So I also apologize for my voice today. I am battling a rough cold. And so if I have to take a drink, I try not to do that, but I may have to in order to sustain my voice for the next few minutes. So one of the things that my coalition did during, we received drug-free communities funding in 2016, and Sources of Strength was something that, you can go ahead and switch slides, Abby, that began as around, it didn't begin around that time, but it was introduced to the state of Kentucky around that time. So I began my position in November of 2016, and maybe within 2 weeks of prior to actually me starting my position, but we had already received the Drug-Free Communities grant, we had a student suicide, and it was an 8th grader, and so it really hit hard within our middle school family and just across the community to know that we'd had this this young child die by suicide. And then within probably another 3 to 4 months after that, we had an alumni of our high school also take his life. And so again, we were kind of faced with this situation, and our community was not, this was something our community was aware of. We'd had, unfortunately, a string of events like this about 9 to 10 years prior, where we had multiple suicides occur over an 18 to 20 month period. And so, it was something that our school and our faculty had been part of before. And we needed something different. We knew that our typical, while we appreciated QPR and signs of suicide and all of that, we knew that we needed something different, and that something within our community needed to change. And so we kind of began looking around, saying, okay, who can help us? What can they help us with? And around that time, the Division of Behavioral Health actually received a grant to begin implementing Sources of Strength at the state level. And so this was done, I forget what the name of the grant was. I'm sure someone within the DBH that's been there longer than me could probably tell you, but it provided technical assistance to us. It allowed us to bring in national trainers for the program. It provided training materials for us to give to the students and our adult advisors. So it was just a really great partnership for us at that time. It was a good way for my coalition to get involved almost immediately, even though we had been around since, you know, the early 2000s. It was something tangible that we could latch onto right at the beginning and get some easy wins as far as implementing programs into our school system. Go ahead. So sources of strength. So some of you all may be familiar. I know that Ohio has used something, I think, different than sources of strength kind of in the state. It is evidence-based for both suicide and substance use prevention. It focuses on the 3 areas of hope, help, and strength. So when the students are brought in for the training, it's typically a full day training, and we bring in the adult advisors for about a half a day, and then we bring in the students and they train together. And while we talk about suicide, we do not dwell on suicide. We really dwell on how we can give the kids that are in front of us hope and help and strength, and then how they can take that message and spread that to the rest of their district or the rest of their buildings. And we focus on these sources of strength. So this is the wheel that you can see there on the slide. There are 8 sections of that wheel, and we really talk about, you know, what sources of strength do you have in your life, and what could you improve on? So for example, you know, I might say that my family and my positive friends are sources of strength for me, but I really need to work on my physical health or my mental health. They're just not that strong yet for me. And so then maybe I would we would encourage the kids especially to look for someone who is strong in that area. You know, maybe people who have a good relationship with someone that can help them with their physical health, whether it's a doctor or maybe it's their mental health, and they say, hey, I see a counselor for this. You know, I can maybe help you with that. In our second year of training, we actually had a high school senior stand up, and she was kind of talking about some of the things that she'd been working on personally. And she said for her own mental health that year, she had chosen to drop an AP calculus class that was not at that moment beneficial to her physical health, mental health, anything, and that she had since then started seeing a counselor. And so it was really good for our kids to see that there was this, you know, very high achieving student who was struggling and who had to do what she felt was best for her mental health at that time. And by seeking help and then potentially letting go of something that could help her career down the future, she wants to be a math teacher. And but that moment she had to let go of that. So it was really a relatable moment for a lot of our kids. We have implemented this actually in both of our school districts. We have 2 school districts in the community that I work in, Grant County Schools and Williamstown Independent School District, and we have about 100 kids total involved in the program across both of those districts as peer leaders. And then we have adult advisors. We have probably 15 to 20 adult advisors, I would say, from both school districts involved at this time. Go ahead. So see, these are just some of the campaigns. If you guys get on the website, you can see some more ideas of the campaign. They're also all over social media, Pinterest, that sort of thing. Basically what it is a social marketing campaign where the kids really kind of share their ideas and their thoughts around who they can trust in the building. And you all maybe have seen some kind of variations of this outside of even sources of strength. So one of the Trusted Adults campaign is where we take Post-it notes and we have each person write 3 trusted adults on a Post-it note, and then we make a display of those Post-it notes somewhere around the building. And so the point of that campaign is that if, you know, a student is walking down the hall and thinking there isn't a single person in this building that I can trust, and they walk past this wall and they see my name written 35 times on that wall, then they would say, okay, I know that I can go to her. It seems like other people can trust her. Maybe I can trust her too. So we did that. There's a thankfulness challenge, which is what the turkey is about. You know, we just ask people, I'm so sorry, those are my dogs. We ask people to identify what they're thankful for and grateful for throughout the year, which I think in 2020 is going to be a challenge that a lot of us at the school level are going to try to implement. We need people to realize that there is still a lot to be thankful and grateful for, and to kind of hang on to those pieces as we move into hopefully a better 2021. Some other things is the What Helps Me campaign. This is a great one because it really allows people to identify the things that they turn to when they need mental health support, physical health support, whatever it might be. So we ask staff to participate in this one. And so we'll have, you know, my name or the counselor's name, and I'll say what helps me when I'm having a hard time is maybe spending time with my family or reading a good book. And then it gives people ideas. Sometimes people don't think they only think there's certain things that can help them, and they don't realize that spending some time outside might be a good boost to their system, especially when we're talking about teenagers, right? They automatically just kind of lean one direction, and it's like, let's open their eyes a little bit and say, here's some other things that are good alternatives for you and can really help boost your mental health or your physical health at this time. Okay, Abby. Sorry, excuse me. So again, here's just some other campaigns. A lot of these you can find on my social media channels. I have a Facebook page and an Instagram page that we update pretty regularly. Our schools do too. But again, it's just getting kids to be able to share their own positive stories, whether it's time that they helped someone or they felt helped by someone in the building or someone in the community, letting them identify that person, identify how that person helped them, and sharing those moments of struggle and then the moment of how it turned around is really helpful to other people too, to know that they're not alone, that they're not the only one struggling with this specific issue in that community is really important. And we've seen a big turnaround in our culture within our schools of people being willing to seek help and asking for help when they need it. And that was what this whole thing was, is getting our 7th and 8th graders and even younger than that to go to a counselor and say, hey, I need help. I'm struggling. I am thinking about, harming myself when I go home today. I would like for you to help me make that not happen. And so while our counselors are seeing higher numbers than before, we at least know our kids are going to them and asking for help when they need it. Go ahead, Abby. I'm sorry, guys, excuse me. So what we did as a coalition to support this, like I said, we started in 2016 with our Drug-Free Communities funding. Source of Strength really hit the ground running in 2017. So we're going into our 4th year of doing it as a district. Our coalition, we went to them and said, here's a program that we think we really need to get behind. We had a lot of great community partners through our local healthcare system, through our managed care organizations, which was kind of a big surprise for us, but it was something they really kind of latched onto and felt like they could help us with. So they helped provide some adult advisor relationships for us, which was great. We also helped support the campaigns financially. So if they needed Post-it notes or markers or pins, thankfully, a lot of the things are very cheap and don't require a lot of support financially, but it was something that we could add to the campaign. And it also helped us create a linkage between the districts. So I'm sure those of you who live in much bigger communities than I do know that sometimes there can be barricades between school districts. And even though they're 2 miles down the road from each other, my districts feel like they are very different and don't necessarily get along the greatest, right? And there's a lot of competition there. And so for us, this was a great way to tie those districts together and let them see, hey, guys, we're all kind of battling the same thing, or this is how this district's carrying out this campaign. What can we do here to make it Williamstown specific, but it still be the same campaign across the community? So there was a really great linkage between our districts, and it really helped our coalition kind of stay grounded and stay engaged. And like I said, we're in our 4th year of the campaign, and it's been a really great success. Go ahead.
Camille, also, someone asked in the question box if Sources of Strength is peer-led.
Sorry, excuse me. So it is, and we let the kids decide the campaigns. They, we, as the adults in the room, we kind of walk them through, like, what does that look like? Who do we need to ask permission from? Do we need to, what hallway could we use? That sort of thing. But yeah, we let them kind of drive the whole year. Typically we meet in the beginning of the fall, and we plan our entire year. So month to month, we sit down and we say, this is what we're going to do in August, September, October, and we carry out those campaigns. And then that gives the adult advisors some time to make sure that we've worked out any kinks that might be coming our way, as far as, admin support or, finding a location to hang a gigantic turkey, per se, things like that. So yeah, but it is completely peer-led.
And was that it? Because I think
yes.
presentation is left. Okay.
Yeah, so yeah, if there's any other questions, about sources, I'm sure Abby will have my contact information, but feel free to add them to the chat and we can address those.
Yeah, and we can definitely save more questions to the end as well after all the panelists have presented, and then after we go through the panel discussion questions as well. So thank you all for adding that. And I do realize that some of the PowerPoint slides weren't able to be viewed fully on your all's end, but I know some people were able to download the PowerPoint slides, and I'll also email them out after. So you should all be able to view all the content perfectly fine on your own end after the fact. So sorry about that. Sometimes with technology, you never know what's going to happen. And now Kim Linkle with the Batesville Coalition. You're able to go.
Hi, so as Abby said, my name is Kim Linkle and I am the director with the Coalition for a Drug-Free Batesville. Our vision is to so that all people who interact in the Batesville community will experience a safe and healthy environment. In 2012, when the coalition was founded, our main focus was around substance abuse. However, with our vision being wanting everyone to experience a safe and healthy environment, since then, we have added some other focus areas to our focus throughout the community. Do you want to go ahead, Abby? So here are just several pictures showing our community. We are a very small community in southeastern Indiana. I think the last census we had like 6,600 people, but a very tight-knit community. Our drug-free community grant is actually, the fiscal agent is the city of Batesville, so our government is very involved in the coalition. We have been very blessed and have many sectors that come to the table. And again, because of the small town feel, everyone wants to be involved and truly improve the lives of everyone. It was in the past couple of years in looking at our Indiana Youth Survey that we really saw a concern for the mental health of the youth in our community. We've been very blessed to date and haven't had recently youth suicide. However, our mental health data from the student survey shows that we have significant students feeling sad or hopeless for 2 or more plus weeks in a row. And that is what really led us to add kind of suicide prevention and really working on building our youth up. Because when we saw the numbers, they were just really staggering to our group. In fact, in 2019, when the students took this, every grade level, 7th through 12th, had at least 20% of the youth that completed that stated that they had felt sad or hopeless for 2+ weeks in a row. So we had looked at that data in 2018, and then many of the grade levels increased again in 19. So of course we were very interested in getting the 2020 data. However, due to the pandemic, that survey was not completed, so we will not have that survey. However, in the spring of 2021, when that survey will be completed, again, it'll be very interesting with the pandemic to see how that even shifts in one way or the other. And so that is one of the main reasons that we as a coalition have added the suicide prevention piece to our work and really brought a lot of community people together to really begin looking at that as well. You want to go ahead and slide it forward? And so really what we have been doing is mainly, and I know Camille talked about this, is really building the youth up. Getting them to a point that they feel that they're not feeling, sad or hopeless, because we feel that is really the way to go in working with our community. So our community has a group called Community Partners. We get together every other month and really just focus on things that are going on throughout the community, talk together, are able to share ideas. So it's actually even a more robust group than the coalition. So I sit on that committee with the coalition, or as the representative of the coalition, but there are many other entities, some of which are involved in the coalition, but others that are not around the table on a monthly basis that we can continue, to partner with and share ideas and figure out ways of what we can do to really increase increase all of our residents to just be more healthy and have better mental health overall. One of the newest programs or initiatives out of community partners is called Be Engaged Batesville. So what we are doing is anytime that a community organization, a business is hosting any type of a family event, we encourage people to take photos and tag themselves with hashtag Be Engaged Batesville. And so that way, just showing people out and about, because again, we know how important it is for families to be out doing things together and just getting outside and getting back to some of that normalcy, especially now after the pandemic. It's been very interesting because that initiative was being talked about prior to COVID-19 hitting. And so now we're just, as we're getting back into things, able to launch that, but we feel that that's very important. We also work hand in hand with Mayor's Youth Council. And so that is a group of 7th through 12th graders. And those youth, we really build into community leaders, and we want them to become leaders in the school. And again, just really letting others know that they are there, to just provide a listening ear, because we know how important, again, having someone to listen to and to share, your challenges with can be. We also do a lot of work with developmental assets and now the developmental relationships, because what we know is the more, the less likely someone is to attempt or even consider suicide if they do have developmental relationships. So if they do have relationships with adults, whether that's a parent, whether that's a teacher, whether that's someone in the faith-based community, whether it's a neighbor, we know that that is vital to the mental health of the youth in our community. And then the last program that wasn't able to be implemented, we're hoping to this school year, is called the Power of One. And our public school superintendent, Paul Ketchum, had come up with this idea of the Power of One. And so they were going to have all students 6 through 12 complete a very short survey and just say, and basically, so each youth could say, do you have that one person within the school system that you can talk to? And even who is that person? So that we know like who those target students are. So if we had, I'm just going to say 15 students or 20 students in a grade level that didn't have that one person that they felt that they could go to, the staff and administrators within the school could then go and target those students and try to build some additional relationships with those that didn't feel like they had that one trusted adult. So we're really in the beginning stages of a lot of this. However, as our data shows, we feel like it's vital that we continue to work on this. There's a lot of statewide initiatives throughout the state of Indiana. So again, starting to get connected with some of that, seeing what other communities are doing. I know several communities, especially in the Northeast, are using the Sources of Strength model. And so we're still, working through and figuring out what's best going to work for our community, but really knowing that that is another focus area that our coalition will be focusing on over the next several years.
Thank you, Kim. Was there anything else you wanted to add, or did you want to, I guess there's no questions in the question box. If you don't have anything else, we can move on to Tristan.
Yeah, that's fine.
Okay, thank you for sharing. And now Tristan Ball, it's your turn.
All right, great, thanks. I know the slides aren't really coming up here, so I'm gonna switch back and forth on screens. So my name is Tristan Ball. I serve as the director of the Montgomery County Prevention Coalition, and I also serve as a senior program coordinator for the Montgomery County ADAMHS Board. So that definitely comes into effect when talking about a lot of the strategies that we've been able to accomplish, having the support of the ADAMHS Board and being able to think very strategically about some of our initiatives. So we are a DFC funded coalition. We received DFC funding in 2018. I came on board in 2017. And since that time, we've been able to grow into a large coalition that has 7 working committees. So they focus on different topic areas, things such as opioids, marijuana, self-care, gambling, what have you. We focus on a little bit of everything. What I'm going to focus on today, though, and I'll have you keep in mind, is this is the work of both the Suicide Prevention Committee as well as the Policy and Advocacy Committee. And then I will kind of discuss the ways in which some of those other more drug-specific committees have come into play and really work together to collaborate on some of these initiatives. Go ahead and advance the slide. So in 2020, we definitely have had our fair share of challenges, as many of you likely have. But what we really operate on is the 7 strategies for community change. I know that that's very specific to drug prevention, but we utilize that model in all of our committees, whether that be self-care or suicide prevention or things that aren't traditionally covered under the CADCA model. So the first thing that we did is we promoted our app. So the Montgomery County ADAMHS Board has an app called Get Help Now. And what this does is this is really a social worker in your pocket. It allows our community members to look at their needs. And then there's an app that they have that they can filter service providers by needs and then get connected. So this is really a partnership with all committees. It has prevention resources, it has self-care resources, it has trainings, all kinds of different and all kinds of different services, even like food access and things like that. But really, we knew that this was very important, just given the fact that individuals that are experiencing suicidal ideation definitely need to be linked with support. The next one is funding a Handle with Care initiative, which is actually being implemented by our Educational Service Center in 4 school districts. So just a quick overview of Handle with Care if you're not familiar. It links any child that is exposed to a trauma where a first responder would be present, whether that's a police officer, a firefighter, or a paramedic. And what happens is the police department coordinates with all of them, and they send a notification to the school the next day to follow up with that child and to handle them with care. Again, this is a partnership between all committees, just knowing the impact that pervasive trauma can have in initiating substance use as well as suicidal thoughts. And then a big one, and I'm sure this resonates with many of you, is the distribution of over 1,000 medication disposal pouches in what we consider high-risk zip codes. So high-risk zip codes have been determined by both opioid overdoses as well as suicide attempts and suicide deaths. And we were able to really map this by looking at heat maps. We've worked closely with our public health department's epidemiology team, and the assistant health commissioner is the president of the coalition, so that helps as well. And we've been able to really target our efforts to make sure that we're making the biggest impact with our medication disposal pouches. The next is we developed a coaster campaign that we wanted to launch in 2020. It's already developed, but we'll launch in 2021. And I know many of you are familiar with the fact that there was a mass shooting in the Oregon district and the city of Dayton in 2019. And it really had a profound impact on the individuals in the area in terms of disrupting their feelings of safety and security. Some of them were very much impacted just given the individuals that were in the area that evening. And it's really had just a devastating toll on the mental well-being of individuals in our community. That combined with, all of the other traumas that we see in our community, such as opioid use, substance use disorders. We had a series of tornadoes come through in 2019, and now COVID. So we partnered, the suicide committee partnered with the opioid and alcohol committees to really start getting coasters out to bars in the Oregon district. If any of you have been there, it's an entertainment district, with coasters that have messages of hope and resources where they can get help should they need it. The next piece that we've partnered with a lot of law enforcement agencies on is distributing gun locks. So law enforcement agencies are wonderful at being able to get free gun locks. So we partner with the Miami Valley Crime Prevention Association, the Miami Valley Child Development Centers, and other behavioral health organizations that do home visits where children are present in homes. So the whole intention behind this is to decrease access to lethal means. And we know that the number one cause of death by suicide in Montgomery County is by firearms. So we have been encouraging community members to make sure that they're locking up their firearms, especially if there are children present, to be sure that we're decreasing that access to lethal means as much as possible. And the next thing that we've been working on, and this is one of the first things that we really worked on, was implementing signs in parking garages. Unfortunately, in Montgomery County, we've had far too many suicide deaths as a result of individuals completing from parking garages, high-rise parking garages. So we were able to implement some signs, just giving individuals resources, giving them, the crisis text line, the crisis number. But what we've actually, signage is great and signage is important, but what's even more important is completely decreasing the access to lethal means. So we've worked closely with Montgomery County, and in their 2021 budget, they have budgeted for putting physical barriers around the parking garages so that individuals won't die by suicide. So what we're looking for in 2021, if you want to flip the slide. Okay. We are looking to work closely with gun stores and shooting ranges to distribute crisis line information. We want to actually do some suicide prevention training for gun store owners and gun store workers, just to be able to recognize maybe some of those signs and symptoms of individuals that may be contemplating suicide or may be showing signs of mental unwellness. We will be continuing to expand suicide prevention trainings in the community, question, persuade, refer training, mental health first aid training, and assist training. And we're really targeting what we'll consider high-risk populations, veterans, LGBTQ organizations that serve the LGBTQ community, as well as the areas of Montgomery County that have been most devastated by trauma. So specifically looking at the areas impacted by tornadoes, the Oregon district, and then also looking at those most impacted by the opioid crisis, just knowing the way that that has impacted families. So we are doing gun lock distribution. We have developed a partnership with Children's Services. So Children's Services workers will actually be giving them during their home visits to make sure that parents have the ability to lock up guns. And again, we're working with the city of Dayton to look at creating an actual ordinance, but apparently we have to do some state advocacy to change some work around building codes to actually make it so that all parking garages have to have the physical barriers rather than just our county garages. While it's great that our county garages will have those physical barriers, we know that, I should say, the parking garages owned by the county will have physical barriers, but some of the private businesses that have parking garages, we want to be sure that we're reducing we're reducing the access there as well. We are working to develop a local influencer campaign to promote and normalize seeking help post-traumatic events. There's such a stigma around mental health services. Excuse me. And this actually came from an idea the mayor of Dayton had posted right after she had posted after the Oregon district tragedy that she had gone and seen a counselor. And so as we were talking in the suicide prevention committee, we wanted to normalize those behaviors and really talk more about what does that process look like, and letting everyone know that it's okay to reach out in times of need. And then we're continuing to support our suicide prevention providers, those that provide signs of suicide training, hope squads, second act, and then screening, brief intervention, and referral to treatment. Overall, I believe we are serving over 7,000 students with those programs this year, which is really exciting. You can go to the next slide. And I'll just quickly go over this. So I am the director of our DFC grant. I'm also the director of the Zero Suicide and Health Systems program. Excuse me. I'm not used to talking this often. All right. So what our goal is to train healthcare workers in assessing suicidality in patients that they're seeing. We know that unfortunately those that die by suicide, 45% of them had seen a primary healthcare physician within a month of their suicide. And so what our thought was the importance of really making sure that we have those individuals equipped to be able to fully assess suicidality and to get those individuals linked with care. This year, we'll screen 46,000 patients for mental health concerns and suicidality through our FQHCs. All right, we will implement, we're going to implement mobile crisis outreach teams. These are very similar to the quick response teams that many of you are familiar with for opioids. We should take a little different approach. It's a little more sensitive when we're working with individuals that have suicidal ideation. But I won't go too far into that, but that is one of our one of the big things that we're working on. Disseminating, decreasing access to lethal means information to really 10,000 community members, but working through those hospitals and FQHCs and primary care settings. And then implementation of the Montgomery County Suicide Emergency Response Notification System. So what this will do is anytime an individual presents, say for a suicide attempt in an emergency department, this will notify the behavioral health agencies that, you know, if they have been linked with, say, a provider in the past, it will notify that provider that they need to be linking up with that individual and continuing them on with care. If they haven't been linked with a behavioral health provider in the past, it will make sure that those individuals don't fall through the cracks and that they get the care that they need. So this really has come from a lot of the ideas of the Suicide Prevention Committee within the Montgomery County Prevention Coalition, which has been really helpful in really guiding a lot of these strategic priorities and understanding the way that we need to impact our systems and our policies to better serve the residents of Montgomery County. And then the next slide is my contact information. If you ever have ideas that you want to just chat about, or you have questions about ways that we've done things in Montgomery County, I'm always here to talk or to listen. By all means, I'm happy to help any way I can.
Thank you, Tristan. And there is a question from the question box for you. So how long did it take and how much did it cost to develop the Get Help Now app? And then how was it rolled out or marketed?
Okay. I don't have an answer on the costs. This was under a different department as me, but I think it took about, I want to say about 2 years really in the development of that app. And I can send out more information as well about that. But really, we just started with our Adamus providers, so behavioral health providers, and then it's just grown due to community needs over the years. I want to say it was launched in 2018, may have been launched in 2017. So obviously we've had a couple of years to really be a little more expansive in adding services. Did I answer that?
Yeah, thank you. And then another question came up. What's the difference between your suicide emergency response notification system versus the mobile crisis outreach teams?
Yeah, so the mobile crisis outreach teams is, they will be part of that notification response system. So the notification response will go out. So I had mentioned if there is not already a linkage to a behavioral health provider, that outreach team will actually go out and do that work.
Okay, thank you. And then someone else mentioned in the question box that they're getting ready to launch the Get Help Now app in Logan and Champaign counties in Ohio. It took them less than 5 months to launch, and then she can discuss costs. So maybe she can explain to me, or if she wants to put her contact information in the box, I can share that with the audience. So if you wanted to share that, that would be great for the rest of the audience.
Well, and I will say, if you're in Ohio and you're, I guess even if you're in a different state, and your board has interest in launching the Get Help Now app, we are happy to collaborate and kind of share our method.
Thank you. So for anyone in Ohio that, or I guess just wants more information on that Get Help Now app, please reach out to Tristan, and then also Cecilia Gelton shared her contact information. If you want to figure out costs for that, I'm going to share her contact information. And she said she can connect people with the Ascend Innovations, which can help kind of filter all that logistical information. So thank you all. And then also after the panel discussion questions, we're going to have an opportunity for the audience to ask all the panelists different questions, and you can refer back to each of the information that they shared, and I'll also share all their contact information at the end. But we're going to go ahead and get started with the panel discussion. And then I'll jump back to the previous slide. But for right now, so Camille, what are the biggest challenges when collaborating between suicide and drug prevention in your experience?
Typically, it's getting the kind of the right partners around the table. And I think that that's a lot of times what you're thinking about, or your challenge when you're kind of thinking about any prevention initiative. And you have to look for those non-traditional partners sometimes too. But for us, specifically with Sources of Strength, our kind of non-traditional partners came in the form of the managed care organizations in the state of Kentucky. So like Humana, Anthem, that sort of thing, that kind of run our Medicaid, Medicare programs. That was kind of unexpected, but they were a big proponent for the program, and they came in, they provided the presentations to our Board of Education to kind of get the program started. So it's finding those partnerships can be a bit of a challenge. Knowing where to look, knowing, you have to, obviously always find the people that are passionate about the topic. But then you have to find the people that are connected as well. And so passion, unfortunately, isn't always what we need. We need the passion and the connection, and just making sure that you have both kind of present when you're ready to move forward with implementing a new initiative.
Thank you. And then this question for Tristan, how do you manage meeting fatigue among stakeholders? This can be in general for any of your subcommittees or just general coalition meetings?
Yeah, that's a good question. So what we really do, and I think really the power of coalitions is putting it back on the individuals. So often, I think we have these wonderful initiatives that are developed, and then when it goes to implementation, you know, people stop attending meetings because they don't want to be called upon. And you know, I mean, I'm just going to be very honest, and I think it's a time to go back and reevaluate strategies at that point. If no one is willing to take on an initiative, is it really important? Is there readiness in the community for it? And what we found with COVID even is that it's been a time to really reevaluate what we're doing in the time of, you know, social disconnection. So I think just bringing those new ideas to the meetings is important. Making sure that everybody has a purpose, that, you know, individuals are being assigned things. If they do miss a meeting, that, you know, we're going back and we're sending out meeting minutes so that they know what they've missed. But it's really making sure that individuals understand their purpose in the greater scope of the coalition, and that, you know, always making sure that you're making a decision at every meeting, and that things are progressing forward, because nothing is going to stifle a group than just having the same conversation meeting after meeting.
Definitely agree from personal experience that you need to have action-oriented meetings and have those action items present at the table, but also make sure that you come up with some sort of resolution or you know, something to just show you accomplished something, even if it's just simply deciding the next meeting date. So thank you for sharing that. And then this question is for Kim. How have you worked on reducing the stigma associated with suicide and drug prevention? It could be separate or it could be just in general what you've done in your community. Please share.
Yeah, so, you know, we, again, as I mentioned earlier, we really work on building the individuals and the family units. And so instead of almost trying to reduce the stigma, we try to kind of flip that and really try to build, you know, the importance of that connectivity and having that person to go to, and not shaming. I mean, unfortunately, you know, there are many, many families in our community, in our region, in, you know, our state and our nation that, you know, deal with either, you know, suicide and or, you know, challenges with drugs, and people, you know, either with overdoses or, you know, addiction. And so really letting families know not to be ashamed of it, but to really reach out, and, you know, there are people there to listen and to help guide them to get their loved one help, whether, you know, no matter what they're dealing with. And so I think the biggest thing is, again, just, you know, bringing everyone together and making sure everyone's on the same page. So we have the Choices Emergency Response Team, and they have been just amazing because they keep us up to date on many of the things that, you know, and the challenges and drug trends that we're seeing locally in our community. And I feel like that's been very important. And it's been a way for even, you know, friends of mine or friends of people that sit around the coalition, you know, to have those connections and to be able to connect those people having challenges and their family members with each other. Because I think, you know, first of all, someone admitting that they may need help, or they, you know, they're dealing with something, is that, you know, the pivotal point that we need to make sure that we can make those connections immediately. And so continuing to have those relationships and those connections within not only our coalition, but then our community partners, and even, you know, broader, just community wide, to be able to connect people right when they need assistance, and not say, oh, I'll get back to you in 3 weeks, or, you know, let me get with this person, I'll see what they say, you know, but really to be able to make those connections immediately, because we know that's when the person or the family truly needs help.
Thank you, Kim. And then this question back to Camille. How have you educated the community and or coalition partners on the intersection of co-occurring disorders? So for those that are unaware of what a co-occurring disorder is, it means when someone does have a mental health disorder or mental illness and a substance abuse or misuse disorder.
Sorry, excuse me. We have relied pretty heavily on data for this. So our student surveys in Kentucky, it's called the KIPP survey, and it's taken every 2 years, and they ask questions about, there's mental health questions and then substance use questions. And so we rely pretty heavily on our data to kind of show that, you know, we have students reporting high rates of 30-day use of alcohol, marijuana, other drugs. And then we also have students reporting that they have either attempted to harm themselves, you know, in the last 12 months, or they have had a plan, or they've had, you know, some serious suicide attempts as well over their lifetime or in the last 12 months. And so we tend to kind of stick with the data sharing in that instance. Thankfully, both of the school districts that I work with are very open about sharing information. Clearly, we're not sharing student-specific information, but we are sharing, you know, kind of county-wide data about what our kids are saying they're experiencing. And, you know, if they feel like they're being bullied at school, or they're afraid to even go into the buildings, that sort of thing. And my districts have done a really good job of trying to address those issues and being very specific about, okay, well, they say they're afraid in the bathroom. Why are they afraid in the bathrooms? And what's happening in the bathroom that we're not, you know, that we're not in there for? And let's get someone in the bathroom during breaks or whatever to make sure that the bathrooms are safe for anyone that might want to go in. And so it's been really good for us to you know, continue to share that information across the community. And you know, and I feel like it's more tangible when it's when there's a number behind it, and it's not this kind of concept of us just saying, okay, your kids are saying they're having mental health issues, and they might also be using marijuana. But no, we're saying that 30% of our kids are doing this, and those same percentage of kids are also reporting that they're they've experienced self-harm. And so that's been a really good tactic for us, and it's been a good way to get our partners on board as well. You know, our counselors in both districts have really jumped onto not just our coalition, but, you know, as well as the Sources of Strength program. And so it's been a good way to kind of keep those relationships moving, and to always just be really open about sharing data and about what we all know to be the problems. You know, there is no point, especially in, I mean, if anything we've learned in 2020, we can't run from the information, we can't run from the data. So let's just be open and honest about it. It's something to be ashamed of, and let's just address the problems as they're coming towards our district.
Yeah, thank you. And just to, I guess, kind of reiterate with data for Kentucky, they do a Kentucky Incentives for Prevention survey statewide, and for each county and district, they are able to have their own individualized data. And then for Ohio and in our service region within Greater Cincinnati, we do a student drug use survey as well. And then Kim, what is the statewide program or survey in Indiana?
Yeah, so we do the Indiana Youth Survey, and traditionally it had been offered every year. Actually in 2018, I believe, is when the state actually went and did that, set it up for every other year. However, we as a school corporation or a community can choose to pay for that and get that data every year. And so that's why, and we do choose to pay because we do want that annual data to be able to show those trends. But yeah, so it's the Indiana Youth Survey through Indiana University does the survey.
Thank you. So I do encourage those to look to see what's offered within your school district, within your county and statewide. If anything, you can look at the youth behavioral health assessment. That's national data, and then just look to see what are the trends in your area. And then I do have someone else that mentioned that Ohio has the Ohio Healthy Youth Environment Survey that's available free to communities. And then I'll share that link for that. So thank you for sharing that. So I will send this to everyone. And then I'm going to go to the next question. And then thank you all for adding questions to the question box. We're going to address them after. We have a couple more questions for the panel. So for Tristan, what connections have you made between suicide and drug prevention in your community? For instance, do you see a lot of suicides where substances were found in high levels, or do you see people struggling with addiction also attempting or dying by suicide?
I mean, I think we can really look at the fact of behavioral health as a whole and the fact that so much of both substance use as well as suicidality is linked to an individual's mental unwellness, mental illness, as well as trauma that they have experienced throughout their lives. So really where our focus lies is on with preventing trauma as well as combating that trauma. So that's really, I mean, my big goal in my division right now is intervening on every child that has experienced trauma and providing an early intervention. Which if we can do an early intervention on every child that experiences trauma, we will have a very different landscape in all of our communities. So often that goes untreated. And that unfortunately the traumatic experiences generally aren't singular events, they happen over and over again. So what we really focus on more often is really fostering that resiliency both at an individual level as well as a community level, making sure that our communities have the resources to be resilient, and that there is some connectivity between the individuals living in a community in terms of, you know, really there's a lot of overlap I find between substance use as well as suicidal ideation. We certainly have data that can support some of that. So often, and this is a huge issue that I don't have the answer to, many suicides go unreported because they're drug overdoses. I worked in an emergency department for about a year where I was working with individuals that had overdosed, and so often they would tell me that it was a suicide attempt, but it doesn't generally get coded that way, so we don't have data to support that. So while we can have all of the data in the world, it's going to be very imperfect. So which is why I think we need to do more work linking both opioid prevention to suicide prevention.
Thank you. And I definitely agree with all of that. And thank you for sharing that. And then this question is for Kim. So what advice do you have to suicide and or drug coalitions that want to begin working together?
I would just encourage them to really think about the partners that should be at the table from the beginning, to be inclusive and not exclusive, to bring those that are working in that area or lane that may be interested and they may not, but definitely invite them to the table. I also think it's important to make sure that we don't just add another meeting for the sake of adding another meeting, you know, so is it a conversation that can even begin in other organizations or groups that already meet, and then maybe, you know, go from there. And that's exactly what happened in our community. You know, there was some conversation about the data that we were seeing come from the Indiana Youth Survey, and then our domestic violence shelter had some, you know, concerns of some things they were seeing as they were going into the high school doing some programming. Our YMCA, same thing, you know, they were just seeing some youth that were having some challenges that were coming to, you know, them, whether it was the after school program or just there, you know, to be at the Y in the after school hours. And so, you know, really those conversations led to bring everything together. And so that's where we started with just the three groups talking, and then we've since invited the library, now the schools involved. So really, you know, having those that are interested in it, you know, that have the expertise in those areas, whether it's coalition development, or, you know, working with a coalition, whether it's specifically suicide prevention, you know, drug prevention, but really making sure that you're inclusive. But again, I would strongly encourage people not just have another meeting to have another meeting. If you can infuse it into something that is already going on, to definitely do that, because we know, you know, it seems like we see the same people at so many meetings over and over again. So, we're just wearing out the same people. And then I know Tristan mentioned, you come up with these great initiatives and then you're sitting there and no one says, oh, we'll take that on, or we can do that, or I'm willing to do that. So even though it may be a great initiative, a great program, the same people can't keep doing everything, or truly, is it truly what is best for the community and what the community would be truly invested in?
Well, thank you. And now we're going to jump to questions from the audience, and I'll refer back to some that asked questions throughout the presentations. So I think this question is for Tristan. So what were your most effective forums for gun lock distribution?
Yeah, so as wonderful as it is to have like an awareness campaign on this, that isn't always going to work. So the first thing we did was there was actually very tragically an accidental shooting where it was a young boy and his parent didn't lock up their firearm and he accidentally shot himself non-lethally, thank goodness. But so we immediately did a press release and we said, hey, we have these free gun locks. We had just gotten the gun locks that day and we had about 15 people respond. So we're like, okay, well, maybe that's not the best way, which is why we decided to partner with gun stores and pawn shops. And well, that has some level of impact. Oftentimes new firearms, you get a gun lock with them. And other times gun stores already sell gun locks. So then why are they going to give them out for free? So what we found most effective was to work with behavioral health providers and children's services and the Child Development Center, which goes out and serves families and links them with social service needs. So as they're going out and doing their home visits, we're building it into that system. So, they will have that resource. Usually they're already asking the question, is there a gun in the house? So if there is, then here's a gun lock. And, we have some literature just to provide to just show the importance of locking up a firearm.
That really helpful and definitely needed for sure. And then another question, I guess, just in general, have you had any success working with the community and specifically the adult population? So sometimes prevention can have a focus on youth, and understand that we're trying to make sure, consider the adult population for the data. He's seen suicide as a leading cause of death among youth. And then the highest risk group is 45 to 64 among that age group. And then we've tried to reach and teach QPR, which is question, persuade, refer, for those that aren't aware of that program, to businesses. But are there any successes anyone has experienced bringing in the older population?
I can answer that. I mean, a lot of the work that we do is around policies. So obviously, as we do that work, you're gonna impact everybody, but you're definitely gonna impact your adult population. In the Dayton area, we have Wright-Patterson Air Force Base, so we have a large vet population, which has been really a target for our coalition, and working closely with them to get some trainings out, and working also closely with some of those more non-formal organizations that serve vets as well. One of the things that we've talked about is getting into like the family groups that have vets and getting them trained in QPR, to be sure that they have the resources that when their loved one comes back, if there are any signs of mental distress, that they can follow up with that. In terms of QPR, mental health first aid, just getting community trainings out, I'll just be honest, we're very fortunate. We have a training division that is able to connect with all of our community health providers, as well as, I mean, they have a really big reach into the community. it's more about finding those community members that have the willingness and have the time, which means that we have to offer trainings on weekends and evenings, which for some of us can sound like not wonderful because a lot of us work 9 to 5, right? So it's getting a little uncomfortable and being able to do that. We do recorded sessions so that individuals can experience that as well. Just a word of caution, do not do QPR as a recorded session. It has some very sensitive topics. So please be mindful of that. But in terms of, like, we partner with a local news station to do some education as well, just to be able to make it as accessible as possible.
Yeah, thank you. And I do know I've been trained in youth mental health first aid, and I'll be trained soon in adult mental health first aid. And I know, I believe that's through your office, Tristan, if I'm not mistaken.
Probably.
Yeah. But the Ohio Department of Mental Health and Addiction Services does have a lot of resources. And I believe it could be potentially open to people outside of the Ohio area, just because of being virtual. I guess I could send that out and check in about that, and then share about other resources I know outside of Ohio. But certainly, yeah, that does reach that adult population. So thank you. And then another question for all, which is a great question. How do you distinguish between a coalition activity or an initiative and an individual agency's activity when they're also a member of the coalition?
So I can answer that. I would say an activity is something that occurs one time and is supported 100% really by the coalition, versus an initiative is something that is ongoing and something that we do either over and over again, or we work to a final goal. And so I think that's what I would define that as. And then what was the second part of that question?
I guess versus an individual agency's activity when they're also a member of the coalition.
And again, I always think of it, how was the coalition involved, or was the coalition involved? Many of our partners do things in addition to the work that we do as, a coalition. However, many times, we partner with different organizations that do sit on our membership. So then we would say, that we are both entities are working on that. For example, we work real closely with the community outreach group at our local hospital, and many of the drug awareness, drug prevention programs and initiatives that they do, we partner with 100%. However, they have other programming opportunities that truly don't really meet the needs or the focus of the our drug prevention coalition, and so therefore that would be something that they would be doing on their own. And so I always think of it as, if we partner together and really, work together to develop that, then we would, be co-sponsors or co-leading those activities and initiatives, versus if, that entity worked on it, then it may not be necessarily a coalition activity or initiative.
Thank you. So if there are other questions, please add them to the question box, but I'm now monitoring the attendee box. So if you all want to raise your hand, I can unmute you and you can verbally ask your question, or if you want to just comment on any of the information presented today, or if you want to share if there's other resources in your community that was not shared, please let us know. We'd love to hear what else is going on outside of, in the 3 panelist areas. I'm getting lots of praise from the audience for the information. But once again, I want to thank everyone for attending, but please feel free to add any questions for the panelists, or raise your hand and I can unmute you. And then if not, I'm going to go back to that one slide that had information. So this is information from the Ohio Suicide Prevention Foundation. They are collaborating with really the national group. They're putting on a Midwest Suicide Prevention and Mental Health Summit. So I have information on, it's a free mental health summit virtually for October 20th through the 23rd. It is open to coalitions and organizations dedicated to preventing suicide and promoting mental health, wellness, prevention professionals, healthcare professionals, veterans serving organizations, state and community leaders, and others dedicated to community solutions to address the public health problem of suicide. So the registration link is on this slide, and I'll also send it out and in the body of the email that I emailed to everyone that is in attendance today. And Michelle Price's information from the Ohio Suicide Prevention Foundation, which is leading the planning of this conference, is on this slide, as well as her office phone number, but it's also going to be in the slides that I send out. And I'm going to go back to the question box, or let me go back to the beginning for all of the panelists, and then I can send out, if it's okay, ladies, your information for people to reach out to you for any information that they might need. Excuse me. And I'm going to try to go back to the question box, but it disappeared on me for a second. Let me see. I don't see any hand raised. You all see the question box? It disappeared on my end.
Yeah, I can see there is some information about how Stark County has addressed the integration of substance use prevention into the suicide prevention work that they're doing. So we can copy and paste that information and put it in the chat. There is a question around, once a child or youth gets initial help and support, what steps are taken to ensure that they are making healthy choices for themselves? And I'm so passionate about this issue. I'm happy to kind of take it on, and Camille and Kim, if you want to jump in. There is no wonderful, like, one size fits all answer that I have to this, but I say so often that we can give people all of the resources and skills in the world, but if they're going back into environments that don't support that, how can we really expect there to be any change? So, you know, an example of that would be in their community. Are there factors that are in their community that are exacerbating either substance use or mental illness? And, you know, there's all kinds of research that show how you can set up a community to really look at preventing both mental illness as well as substance use, and making individuals feel more safe in their community and fostering a sense of belongingness. But then also, it's a big part of it is the home that they live in. You know, are the parents supportive of those interventions? Early on in my career, I did a talk around marijuana prevention, and I was working with a young man, and he was like, well, what if it's your parents that are giving you marijuana? Like, how do you say no to that? And I was like, that's a great question that I don't have the answer to, because I hadn't thought of that. So I think it's important that we do just as much work with the youth as we do those that have the ability to influence youth. And I'll say that can be a little more difficult, because as adults, we're really stuck in our ways. So yeah, if I can give any advice, it's looking at the environments in which children or youth are interacting in.
Thank you. And I have the question box back, and I added in that resource that from Stark County to everyone. And then do any of the programs train substitute teachers? And I know just for in general, they use mental health first aid as well as adult mental health first aid. For my experience where I got trained, it was in Boone County, Kentucky, that they were basically getting the general community trained in the information. And I believe that's in general across the board from other groups that are putting on that information, that it's really for anyone, that it could be influencing youth or working with adults that could be potentially experiencing mental illness or mental distress. Certainly that's not just geared towards teachers. It's in general, and of course, if you're a substitute teacher, you're working with youth, sometimes maybe even, depending on how often you do substitute teach. So definitely that's a really great resource. Are there other programs, I guess, on your experiences, ladies, with for particular substitute teachers or teachers in general, maybe?
I know our school does the mental health first aid for the staff as well as the QPR. However, I'm not sure that substitute teachers would be included in that, but I think that's a great idea. So that may be something I may, go back to the schools and say, how are they, or, at least is it offered to them? It may not be mandated, because they may not be able to cover those costs or whatever, but as part of their time, but at least I think, because many times the substitute teachers, they're not as equipped maybe to deal with challenges that the students may be facing that those that are in the school building every day are. So I think it's a wonderful idea. I do not know that our schools do that though currently.
In addition to substitute teachers, though, I would also encourage, while we're thinking about kind of different people to add in there, I think that your custodial staff and bus drivers also, those are kind of our unsung heroes anyway. And they're also the people that tend to be ignored sometimes because of their positions within the buildings. And so kids will stay and do things in front of them because they don't consider them, not that they consider them, it's not that, it's just they don't think that they can get in trouble. And so they'll say things or do things in front of them, not really thinking, okay, this person can't actually tell my principal what I've done or said on the bus. And so I think it's just equally important. And, the bus drivers are the ones who pick them up and drop them off at home every single day and know what they're leaving them with. And so sometimes they're the first point of intervention for a lot of districts, and realizing that they really do play an important role with our students can go a long way. But Sources of Strength does not train. We did actually reach out. We added custodial staff as our adult advisors, but it also doesn't really, it doesn't necessarily target substitute teachers because of the type of the program. We're trying to build those relationships, and substitute teachers may not always be in the building enough to have a continuous relationship with our peer leaders and other students.
Thank you. And we are over time a little bit, so I'm going to go ahead and go over the post-training information, but I do want to thank all the panelists and attendees for today, and thank you everyone for sharing your comments, your other resources in the chat box, and I'll certainly be able to email all that, as well as the recording of this session and the PowerPoint information and all of the panelist information if you'd like to reach out to them. And I really like the discussion today. It's a very important topic, really now more than ever. Once again, the post-event evaluation will be emailed to everyone, so you can enter your CHES ID or social worker counselor license number to receive those continuing education credits, as well as for prevention professionals. Recording and supplemental materials will be made available on our website, which our website is listed on the screen under our training hub. And then you can follow us on social media, on Facebook and or Twitter. We do post events as well as trainings that we have coming up, and do share alcohol, tobacco, and other drug, as well as mental health awareness information and gambling prevention information on our social media. And I do encourage you also to follow the social media pages for the panelists organizations, because they also share great information. And in the prevention field, it's a collective effort to raise awareness and prevent. So once again, thank everyone for attending this morning, and I'm going to go ahead and close out. Just want to make sure there's no other questions. But once again, thank you everyone for attending.